Good evening. I am Congresswoman Young Kim, your representative for California's 39th District. This includes parts of Los Angeles, Orange, and San Bernardino counties. I want to thank you for taking the time this evening to join my virtual COVID-19 town hall. I'm so excited to have our special guest, Dr. Sajjan Matthews and Dr. Mrna Vaccine, who are no stranger to us, especially in our district. They are sharing their time with us tonight to share their expertise and answer your questions on the pandemic and the vaccine. First, Dr. Sajjan Matthews is the Chief Medical Officer at Providence St. Jude Medical Center in Fullerton. And Dr. Mrna Vaccine is a pulmonary disease specialist with American Sleep Medicine. The COVID-19 pandemic is very real, and it has impacted each of our lives. And many of us have lost many loved ones and friends and relatives. I too lost my mother-in-law to COVID. You know, we must remain vigilant and follow public health guidelines as we work to safely reopen our communities and keep ourselves and our loved ones healthy and safe. That's why I'm excited to have local experts here today to share the facts on coronavirus in our community. We must focus on distributing the COVID-19 vaccine so all who are eligible and want it can take it, and follow the science to safely reopen our economy and the communities so people can return to normal daily life. As your representative, I'm pushing for a bipartisan targeted $160 billion COVID-19 vaccine distribution package that will directly serve our community and that both sides of the aisle can agree on. I've introduced a bipartisan bill to help small businesses get COVID-19 tests, PPEs, and other supplies to safely reopen, and a bipartisan bill to expand mental health resources during the pandemic. I'm committed to working in a bipartisan way. The only way we will get through the pandemic is by working together. So now I want to turn this floor over to Dr. Matthews and Dr. Vaccine to first introduce themselves to you. So Dr. Matthews.
Thank you, Young, for the introduction. I'm Dr. Sajjan Matthews. I'm the Chief Medical Officer at Providence St. Jude Medical Center. As you know, almost every single hospital in Orange County and LA was inundated with COVID patients, and we especially had a significant load that we so far successfully dealt with. And like Kim said, we have to follow the science wherever we go, whatever we do. Mm-hmm. And I will be doing a short presentation primarily relating to the COVID vaccine and the science behind it, some of the side effects, and the efficacy. So thank you, Young, for having me on this forum.
Great. Thank you. Dr. Vaccine, would you like to introduce yourself?
Yeah, first of all, thank you, Congresswoman Young Kim, for the invitation. I'm really excited to be part of this panel. First of all, I am located in Fountain Valley, Orange County location. I'm also located in LA County, which will be mostly towards the Valley Hospital. So for last 10 to 12 months, we have seen at least thousands of COVID-19 cases, and progressively since summer, the cases continues to increase. In December and January, we reached our peak, but now the cases are coming down, which has to do with vaccination and all the precautions that we are taking. So it's a very serious threat to all of us, everyone in different counties, all over US, all over the world. So we just have to be very cautious and continues to get vaccinated and get at least 75% of the population in US and around the globe to be vaccinated in order to get herd immunity, so we can fight this infection better. Thank you.
Thank you very much. I know, Dr. Vaccine, we've done numerous town hall meetings together last year, especially when COVID-19 was really serious and affecting all of our communities and individuals. So I want to thank you again for taking time to join me last year and also again today. So now I would like to ask Dr. Matthews, I believe you had a presentation you prepared to show us on the current status of the coronavirus pandemic in California. Please go ahead.
Let me just pull up the slideshow here. Are you able to see my slides?
Yes.
Okay.
Yes.
Thank you. So this is a picture of St. Jude Medical Center, the front parking lot. This is currently what it is. And this is a field hospital that we had ready just in case that we needed to see more patients than we could accommodate in the hospital. At St. Jude, our normal capacity, bed capacity is about 303. We went up to 384, which we managed by going into the parts of the hospital that were approved for us specifically for the COVID crisis that we normally don't use. But had we exceeded that capacity, we would have used it. So far, we didn't. So this is a reminder of how close we came to even expand beyond the physical capacity of the hospital. So like Dr. Sharif said, it's been a long year. We went through phase 1 or wave 1, wave 2, and the third wave was very similar to the rest of the world. We went through a huge wave just recently, but luckily for us, it is coming down, significantly down, and hopefully the trajectory will be even more back to baseline. So I'm going to speak primarily about the COVID vaccine and not entirely about the COVID manifestations, which will take too long. So COVID virus itself is like a ball with spikes on it. And that spike is important for COVID virus to enter the cell. That's how it anchors to a cell with a spike and gets in. And this is a picture of the spike protein, which is really important for in terms of the vaccination. So when you are exposed to COVID virus, this is what the virus tries to do, get into the cell. But your body makes antibodies, proteins against the spike protein, which if you have that antibody and it attaches to the spike protein, it can prevent the entry of the COVID virus into the cell. And that's what we want to do with vaccines. We want to expose the body to the spike protein so that you make the antibody, and then the antibody can attach to the COVID virus when it enters and prevent it from attacking your normal cells. This is how it does it. The COVID virus, you get antibodies, it attaches to the spike protein, and now it cannot enter and the infection is blocked. So that's the basic premise of the vaccine. Some of my slides were meant for medical staff, so you can ignore the details, or if you want the details, you can go back in the recorded video that Young Kim is planning to put on a website, but we can pay attention to some of the graphics and just the message from the slides. The central dogma of biology is we have our DNA, which carries all information, genetic information, and for it to function, it goes through the RNA stage. The messages are passed on through the RNA and proteins are made. So there are 3 types of vaccines, DNA vaccines. So you can have the DNA coded, so it can make the spike protein, but it has to go through these stages. But currently what we are using here is the RNA vaccine. So RNA is just the messenger. It doesn't change your genetic makeup or doesn't have any information about your gene makeup. It just has information. What we put in is about the spike protein, and it can make spike proteins, which can generate the immune response. The 2 RNA vaccines that we have now are the Mrna Vaccine and the Fisa Vaccine. We also have protein vaccine. You can directly inject protein into the human body and produce an immune response. So this is the other type of protein. You can also have another vaccine called the adenovirus or vector vaccine. You use a virus like an adenovirus, which is a common cold virus, and have it carry a genetic code, and that virus is attenuated. That means it cannot cause any disease and yet can produce an immune response because it has the genetic code of the virus. So that one is the J&J virus. I'll come to that. J&J vaccine, I'll come to that in a minute. So mRNA vaccine, the Pfizer and Moderna, what we have right now, this is how it is. You take the mRNA, wrap it up in some fat, and then introduce it into the cell, into the human body. The fat is broken down and the mRNA is taken into the cell. mRNA does not last very long in the body and it's very fragile. So that's why even Pfizer and others have to store it at very low temperatures, but other companies have come up with ability to have it at not so low temperature, but basically mRNA doesn't stay in the body too long. Why 2 doses? J&J is 1 dose, but why 2 doses? Initially 2 doses. The first dose, you get the primary immune response, and second dose, you get the secondary immune response. And also, you also get cell memory, which is B cells and T cells, and other than the antibody response, there are cells that can remember that you were exposed and produce a more robust response next time you're exposed to COVID virus. So that was the initial premise. The new vaccine, the J&J vaccine, is a single shot vaccine, and the hope is that you will have as good as this response even with 1 dose. So that we still have to see whether that is possible and how long it'll last. So the initial premise was that 2 doses will last longer and the reaction, the immune response will be much more robust. So how does the vaccine work? So I'll talk primarily about Pfizer vaccine. All the other vaccines works very similarly. Pfizer and Mrna Vaccine use the genetic code to stimulate the immune response. It's designed on a computer. No cells are used. There's no live attenuated or inactive virus. It's not protein-based. It's not DNA vaccine. You cannot change your DNA based on this mRNA vaccine, and you cannot get COVID because remember, it only makes the spike protein. It doesn't make the virus once it gets into your body. You cannot get COVID with this, and you cannot alter your DNA or any genetic information with the vaccine. And what are the ingredients? It's mainly fat and sugar. This is the list of everything, mainly fat and sugar. There's no preservative, there's nothing. It's mainly fat and sugar. So there's no metal, there's nothing else. Mainly fat and sugar, and fat because you needed to coat the mRNA, like I said. So it's fat, sugar, and mRNA. So that's it in the vaccine. So the 2 vaccines right now, we have the Pfizer vaccine, Moderna. Pfizer is 2 doses, 21 days apart. Moderna is 2 doses, 28 days apart. Pfizer has to be stored in a really, really cold temperature, -80. This one is -20. There's a lot of implications for transport and the logistics with Pfizer vaccine. If the vaccines can be stored at room temperature, it's especially useful to transport to remote areas and even in developing countries. So there are some challenges with these vaccines because of the temperature we have to store. So both doses are needed for protection for these 2 vaccines. The vaccines are not interchangeable according to CDC. If you get one, you should get the same one again. However, if the person does not know what vaccine they got before or it's not available, it is possible to give the person the available vaccine. We don't have any studies on it, but it seems like it should be effective. But CDC is recommending not to interchange it. In UK, they initially said you could possibly interchange it, but because of an uproar, they have essentially pulled back. So if you're taking any other vaccine like flu vaccine, it should be 14 days before or after this vaccine. And people with known COVID infection should continue to receive the vaccine once they're recovered. If you are admitted to the hospital and you receive like convalescent plasma, you should wait at least 90 days. Otherwise, known COVID infection should get it. There is also a question whether they should get 2 doses or 1 doses. There are some 1 dose. There are some studies that show that you still get a good antibody response, even if you get 1 dose after a COVID infection. But right now, the recommendation is to take both doses. So this is basically the clinical trial. I won't go into details. They study 43,000 patients, not patients, participants, and they wait for a few months. And total out of these 43,000, 170 had COVID. In the placebo group was 162, and the vaccine group was 8. So this group was divided into 2, placebo and vaccine. So it was very, very few in the vaccine group. The efficacy is thought to be 95%. And since then, we have extensive results from the worldwide use of the vaccine, especially in Israel. And in Israel, when they studied, the real world experience may be different from what we see in the trials, but it seems to mirror almost exactly the efficacy of 95% out of 700,000 patients they've looked at in Israel. So 95%, this is dramatic efficacy that we could only have hope for. Even the flu vaccine is 50 or 60%. This is as good as it gets in a vaccine, 95% efficacy. The side effects, there's a list over here: pain, redness, swelling, fatigue, fever. They occur in small percentage. Most of them go away in 24 to 48 hours. The second dose, you see a little more side effects than in the first dose, but it's not as big a deal compared to what COVID itself is, compared to the manifestations and the morbidity of COVID. This is really nothing. At St. Jude, we've given out 20,000 vaccines. We have seen some of this, but really nothing severe or no serious side effects we have seen so far out of 20,000. But this is essentially the side effects. It's similar to getting a flu vaccine, or some people get a little more symptom flu vaccine. So it's not too bad at all. The reports of anaphylaxis, where you get swelling and you get shortness of breath. The Pfizer had 21 cases out of close to 2 million. That's 11 cases per million vaccines administered. That's very low. And most of them, almost all of them, respond once you give them an EpiPen injection with an EpiPen, or they get a steroid shot in the ED. So almost all of them responded. There are reports of this patient died over here. In Norway, there were deaths. Those have all not proven true that they were related to the vaccine. There's no, there's cause and effect. There's not been proof that it's connected to the vaccine. So there's one thing to remember, like in the United States, 7,800 people die every day. So in a week, it's about 50,000. We may give 15 million vaccines a week. Some of these 50,000 who were in that group may overlap with that 15,000, and they may be having an event that is completely unrelated to the vaccine. Incidentally, they got the vaccine, and we are giving vaccines to elderly. So it doesn't mean that's a cause of whatever they had, the event they had, or death is related to the vaccine, because there will be a significant overlap. So I'm going to talk a little bit about the variant. A variant is when the COVID vaccine mutates, means changes its protein structure. Mutation is when the genetic code is changed, the amino acid or the genetic code is changed, and that in turn changes the spike protein, the shape and the structure of the spike protein even a little bit. The COVID vaccine mutates every 2 weeks, but most of the mutations are not clinically significant. But some, if they alter this region where the antibody is supposed to bind to the spike protein, which I showed in the previous picture, right? So if this is altered, this antibody will not bind on tightly with the spike protein and will not prevent the spike protein from entering into the cell. So that is the fear of the variants that we have, that the variant could prevent or decrease vaccine efficacy, and I will show you whether it does it or not. So the implications of the new variants: it could spread more quickly, cause more disease, may evade tests, but that's not true, and decrease susceptibility to agents like monoclonal antibodies that we have, and evade vaccine-induced immunity. So the variants of concern, we hear a lot about this in the news. In the UK, this is the number, you really don't have to remember the number: UK variant, South African variant, and the Brazilian variant. So we now know that they have a little more efficient transmission, and they don't bind to antibodies as well, and there's reduced vaccine efficacy. So how important is that? We know that they have reduced vaccine efficacy a little bit. How important is that? These two are already here. We don't know about Brazil, and at least not sufficient. Every day there's reports of new variant. California and Cedars-Sinai, they announced a new variant a few weeks ago, but we don't know the details of that, whether the transmission is faster or whether even it causes more severe disease. Today, there was one in New York. They announced a new variant, 1451 or 1456. They announced a new variant. So many of these variants may not be clinically significant or for epidemiologically significant, but some, if they transmit faster, can cause much more disease and public health issues if the transmission is faster. So let's look at the efficacy of these vaccines. Pfizer, Moderna, J&J, Novavax is another vaccine where you only inject the spike protein, like I went over. AstraZeneca and J&J are the adenovirus, that means a virus with genetic particles. So these are all the viruses. They were studied. Look at the UK, US efficacy. Pfizer and Moderna, we think will be 95%. J&J is 72%. And Novavax, which is going to come in a few months, is 89%. But against the South African variant, the J&J and Novavax had dramatically decreased efficacy, 57%, 49%. AstraZeneca had little confusion in its trial, so we don't have all the data. But still, we do see there is some decrease in efficacy in the South African variant. So how important is this? Let me just go to this one before I come down. So just look at the last portion of it. And these are all the studies you can look through if you want to, the number of people they studied, and protection against death and hospitalization, including the variants. They studied in UK and South Africa was close to 100%. So what's important for us with the vaccine, I think it's important to prevent all disease, but the most important thing is to prevent hospitalization. You don't want to be in the hospital, you don't want to be in the morgue. And these vaccines seem to be efficacious against the variant to prevent disease, prevent death or hospitalization. Probably not severe infections and moderate infections. Although the efficacy is less, there is a buffer there, and this is what's important. And I think we should take reassurance that even with the current vaccines, we'll at least be able to prevent hospitalizations and death in the ones that are studied. We still don't have data against the Brazilian, and like I said, new vaccines, new variants are coming up regularly. So what will it take to get herd immunity? Herd immunity is when you can define it as 70 or 80% of the population gets immunity, and then the transmission decreases so much that essentially the disease is not a significant issue anymore. It'll become like the flu-like status. So the combination of actually natural immunity and vaccine immunity will give us herd immunity. So, herd immunity. So this is the projection though, based on the total immunity. If we do 3 million shots a day, we could reach by May threshold, or maybe even a little later threshold, depending on how much vaccine we give over here. It'll be somewhere at that time, we could reach threshold. But remember, by that time, 90,000 people would have died. It's really sad, but at least there's hope on the horizon that we will reach herd immunity at that time. So Israel has done really well. They have 9 million population. They have vaccinated 1/3 of them. And like I pointed out before, the results from there are really amazing. Although I just showed you that it prevents 100% hospitalization and deaths, these vaccines. In real world, it's not as good as that. But out of 100,000 people, about 2.5 got admitted to the hospital. In a regular flu season, 11 out of 100,000 get admitted to the hospital. So it's really, the vaccines are very, very effective. So this is how we feel in the medical profession, that every day new information, we're trying to rebuild the plane while we are trying to fly it, and we all have a piece. I feel almost like this guy. He seems to be drinking something interesting. Anyway, so this is a reminder of how history repeats itself. I came across this poem written in 1869, reprinted during 1919 pandemic. It's really timeless. People stayed at home, read books, and listened, and they rested, did exercises, they made art, and they played. They learned new ways of being, stopped and listened more deeply. Someone meditated, someone prayed, someone met their shadow. People began to think differently, and people healed. In the absence of people who lived ignorant ways, dangerous, meaningless, heartless, the earth also began to heal. And the danger ended, and people found themselves. They grieved for the dead, they made new choices, dreamed of new visions, created new ways of living, completely healed the earth just as they were healed. So thank you. That's the end of my presentation. Can't hear you. Kim, can't hear you, Kim.
Okay, sorry about that. Thank you, Dr. Matthews. That was very thorough presentation, and I hope our audience was able to get some very practical and great information that they don't normally get. But before we get to the questions that the audience are asking, I would like to turn the table over to Dr. Sheriff to have you share your insight into COVID-19 and the pandemic.
Thank you, Yang. First of all, a great presentation from Dr. Matthew. So let me just add some more comments to Dr. Matthew's presentation. First of all, at this stage, there are like 113 million cases around the world, around the globe, 29 million cases in US, and unfortunately, there are 520,000 deaths in US. And regarding vaccination, there are 225 million doses have been given around the globe, close to 100 countries. US has received 68.3 million doses, and path for us to get herd immunity is almost 10 months from at this point. So we are in February, so we are hoping that by October, November, life may be coming back to somewhat normal. And Dr. Matthew has covered most of the details about the vaccination. And I will just add a few more details, which is there are almost 50 different pharmaceutical companies in hunt for vaccine. So the most prominent one he's already mentioned, AstraZeneca has been added. There's a Chinese vaccine. There are two of them. There's a Brazilian vaccine. There's a Bharat vaccine. So end of this year, we should have surplus of vaccine. And one other important thing that we should know is WHO has created an entity called COVAX. And with the help of COVAX, there are multiple pharmaceutical companies have committed to donate vaccine in third world countries at a discounted price. So that will also help, because just reaching herd immunity in USA will not be helpful if the virus is still prevalent in different parts of the world, because people will travel and bring the virus back. And as we know of, the vaccine is effective, but we are still seeing cases of people getting COVID infection even after receiving vaccine. So a week ago, I was doing a presentation and one of the doctors received the vaccine and developed COVID-19 infection afterwards. So it doesn't give you 100% protection at this point. So everyone have to follow the same measures of wearing masks, cleanliness, sanitization, in spite of receiving vaccine. And one other question that most of the people ask is about who can get vaccinated, when they can get vaccinated. So there are different tier systems available, and every county is a little bit different. States are different, so they have changed some of the changes according to what is needed in their particular state. So at this time, we are vaccinating 1A and 1B, and soon we'll go to next year, which will be March 1st, where teachers and school staff, child care worker, homeless shelter, developmental disability institution will be receiving vaccination. So otherwise, I think I'll be happy to answer any question. I saw a lot of interesting questions, so we'll have a discussion in regards to that. Thank you.
Sure. I want to thank you both for your insights and very, very helpful information. You covered a lot of the issues that I know our audience was asking, and we have still more questions that they submitted. So let me go ahead and take the opportunity to ask questions, and feel free, Dr. Matthews and Dr. Sheriff, for you to respond. But we have a lot of questions, so let's try to keep it as short, succinct as possible. The first question comes from Ms. Beverly Berryman from Fullerton. Hi, Beverly. Her questions are in three parts, so let's just go through all that, and then maybe you can just respond all at once. First question is, what safety precautions are still necessary for individuals to take after they are vaccinated? And then you probably addressed this already, but can a person that has been vaccinated still transmit the virus? If so, how? And how long is a person immune after they have contracted COVID-19, and should they get the vaccine still?
Thank you, Kim. Good question. So what safety precautions should an individual take? The CDC recommends that you still take the same precautions. Vaccinated people take the same precautions as if you are not vaccinated, wearing a mask, social distancing, hand washing. One of the reasons for that is although the vaccine provides you immunity, it do not provide you mucosal immunity. That means you can still carry the virus in the mucosal linings of your nose, and you may be able to transmit it. We don't have good transmission data, how much it transmits. There is some data from Israel recently published last week saying that the transmission is significantly less, but it's not zero. You can still transmit. So that's because we don't have immunity in the mucosal linings. You can still transmit. How long is a person immune after? We really don't know. There has been just speculation. It could be 1 year to 3 years, but until we go through this period after when the first vaccinated people are reaching 1 year status or afterwards, and we continue to study that, we won't have an answer. We don't have an answer to whether we should get another shot in 1 year or whether we need a booster shot. And although the variants are there, some of the booster shots would mean that the RNA is resequenced so that we'll be protected against the variant. So these answers we will know only as time goes along, and I'm hoping it'll last between 1 to 3 years. And if it is going to be like the flu, the virus is mutating, then the vaccine makers can actually retool and get approval very quickly without going through the studies. So we won't even know. There'll be a new batch of vaccines annually, which will protect against the variants too.
Got it. Well, you know what, Dr. Sharif, let me pose the next question. This comes from Ms. Eileen Lozano from Fullerton. The question is, when do you anticipate that individuals in the 50 to 64-year-old age group be eligible to receive the vaccine?
So March 1st, as I mentioned, people who will be eligible will be teachers and homeless shelter and other institution, and also age 16 and above with chronic medical illness will be receiving the vaccination. So after that tier is over and done, then the next tier will be 50 and above. So probably I'm expecting the way and the rate we are giving vaccination, probably somewhere in April or May, they should be receiving vaccination in that particular age group. But it all depends on how fast we can vaccinate all these groups and how much vaccine is available.
Mm-hmm. I guess the vaccines will be available for all Californians aging through 16 through 64 once the state enters into that phase 2, right? Of course, depending on the vaccine availability. Yeah.
Yes.
Okay, great. Well, let's go to the next question. It comes from Mr. Curtis Hanlon from Fullerton. And his question is, how much will people not wearing masks impede California's efforts to control the spread of new COVID-19 variants?
Thank you. So, like I pointed out before, although the vaccines are effective against the current variants, known variants, at least the UK and the South African one preventing hospitalization, it doesn't prevent moderate or severe disease in those variants. And the new variants, we don't know. We also know some of the variants are more rapidly transmissible, and some of them may cause more severe disease. So it'll be very significant if you get a variant and we don't wear a mask. We could undo all the work we have done right now, like we saw in Ireland and Portugal when the new variant hit. The number of cases went up rapidly. So that is a potential possibility. Wearing personal protective equipment and doing social distancing, all the mitigation strategies will really be the only guarantee, not 100% guarantee, but to reduce the effect of COVID variants. So it's going to be a significant effect if we stop wearing masks and we do have new variants.
All right, the next question I would like to ask to Dr. Sheriff. This question comes from Mr. Jin Liu from Fullerton. His question is, I'm having a hard time making an appointment to get a vaccine. How can I make an appointment?
I think probably if he's in the age group, the gentleman who's asking the question, in the category, say age 65 and above, or age 75 and above, or between 16 to 64 with chronic medical illness, then can go to Orange County website, and there's a plan which is implicated. There's a software. They just register themselves, and once they register, they will be contacted, and they should be able to get the vaccination in Anaheim resort, where a lot of people with a similar scenario are getting vaccinated. And I think Rite Aid and other pharmacies are planning to start the process of vaccinating people. So once that is in place, then it will be much easier, because we'll have many more accesses. One other thing is, some of the hospitals are also offering patients to be vaccinated. So I can give you an example. So I'm on staff of multiple hospitals. So one hospital in LA has allowed doctors to enroll few of the people they know of. They can enroll them and bring them to the hospital, and they can get vaccinated. And the similar concept do apply in some other hospitals. So those are the resources. Is the Orange County website, register themselves. They will contact them, get vaccinated. Once Rite Aid and CVS will be in workforce vaccinating these people, that's an option. The third option is, any hospital, try to look for local hospital if they're offering vaccination in your age group. And if you can register there, you can go over there and get vaccinated.
You know, I also had the opportunity to visit the vaccine administrating sites in Orange County. There is I went to the one in Disneyland. There is another one in Soka in South Orange County. In LA, I believe there are 7 different sites, and I visited the one in Pomona Fairplex Complex. They encourage you to use othena.com, OTHENA.com, or myturn.ca.gov. If you sign up, what they do is, at least the ones in Orange County, they will look at your name, your age, and then they will divide it up into the category. If you're within that 65 plus age category, they will prioritize you and send you an email, give you a certain very small timeline for you to sign up. And then when the vaccine is available, they will notify you to make an appointment, and you can go in and take that vaccine right away. So those are 2 hopefully helpful places where you can do this, othena.com or myturn.ca.gov. Okay, let's go to the next question. Dr. Matthews, will you take this? This question comes from Ms. Kathy Bergman from Buena Park. How does the process work to register for a vaccine through Providence St. Jude?
So in Providence, we have an integrated delivery system along with the heritage group. So there's 2 portions to that. The hospital itself, there's a website where you can sign on and register for the vaccine. I should tell you that those are all full. And because of a limited vaccine supply, and we are also limited by what the state and the county tell us on whom we can vaccinate. So patients above 65, many of them are able to register through that website. The Heritage Medical Group, which is Providence Heritage Medical Group, has been calling several of their patients to come in to get vaccines. Once again, the vaccine supply is limited, but it's not, the vaccinations are not limited to Providence St. Jude patients alone. Anyone can register, but the question is really the supply of vaccinations.
Got it. All right. I think we talked about this one, but this question comes from Ms. Candy Soares from Chino Hills. Will testing and vaccinations be paid for in full by the federal government? I think I can answer this one. The COVID-19 vaccines are being purchased and distributed by the federal government. So there are no out-of-pocket costs to receive the vaccination. And these COVID-19 tests are available at no cost nationwide through the program called the Families First Coronavirus Response Act. And I'm working very hard right now to try to get the funding to get the vaccine developed and vaccine distributed as soon as possible. So all individuals that need it, that want it, can get vaccine tests as soon as possible. Next, let's go to the question from Mr. Miguel Lopez from Placentia. This question is, we have seen the CDC's guidance on opening schools for in-person learning. With the new variant of COVID spreading in California, is it still safe to have schools reopen?
Means pretty good question. I can tell you during the month. After summer, the schools did open, but there were hybrid version of the school opening. Where there were few students in person and few students doing virtual education. So as the pandemic got worse in December and January, the schools were still going through the hybrid phase. And now with things getting better, I think the student may start coming back, but still it's a very difficult situation as the cases are still on the highest side. They're coming down, drastically coming down. I think as compared to our peak, I think we are down to 50% as compared to middle of January or end of January. So I'm expecting that in another few weeks or so, once the cases are much lower, then it will be much easier for students to go to school. Plus March 1st, teachers will be getting vaccinated. So that will add on to the safety and precautions and the school staff. I think the hybrid model is going to continue for this whole year until the next year starts in August. Then things may be different as we may be getting herd immunity. So at this time, I think the hybrid scenario works the best, and probably few students in the school and few doing virtual education.
Can I just add to that? Yeah. So, this is, if I was running for office, I would not have answered this question. So anyway, but I think that we have to follow the CDC guidelines, and the American Association of Pediatrics recommends to open up the schools. They're pushing strongly to open up the schools. The logic really is this: we are looking for risk mitigation, not risk elimination. We can never eliminate risk completely. And the transmission in the community and the transmission in the schools really mirror each other almost the same. Right now, it's pretty low, at least here, it's coming down low. So if we open up the schools and wear the PPEs and do the social distancing, hand washing, the risk is very minimal. And when we are following the signs, we also have to think of the effects, unintended effects, or on people whom, like a restaurant owner or schools, where it can have so much negative impact. So we have to do this balancing. At this time, I think I would agree with American Association of Pediatrics to push for full opening of schools. Like the variants, the protection is the PPEs. And for the teachers, many of them are concerned. I would tell them this, that the medical staff or the hospital staff were working through COVID wearing PPEs and were fairly well protected. So that's the same concept for teachers. If they wear the PPEs and do the guidelines, they don't have to wait till they're vaccinated. They could go to school right now, but the risk is very minimal. We cannot eliminate the risk. It can't be zero, but I would be in favor of opening the schools immediately.
I think we all agree that we do need to open schools as soon as possible, and we need to get kids in schools. But we have a question related to that. This comes from Ms. Sanda Sun from Fullerton. When can educators get vaccinations in Fullerton? She has registered with Othina, CVS, and St. Jude. Since St. Jude is mentioned, Dr. Matthews, do you give priorities for individuals in certain categories, for example, like in this case, teachers, educators?
So we were trying to do that until the guidelines from the county said it's only 65 and above, but we were trying to give preference to essential workers, including teachers. So now what we do is we give priority for end of the day. We don't want to waste any vaccines. At the end of the day, if there's anything left over, we have a list and we call in teachers to get them the vaccine over anybody else, any other category. So we have been giving them priority, but I think it's only a matter of a couple of weeks or so, we should be opening up. And if we have sufficient vaccine, we'll be able to get it to the educators. But the answer is yes, we have been prioritizing them.
Right, that's good to know. I mean, the educators fall under the state's phase 1B tier, correct? The state opened the
Yes.
ability to phase 1B and requires local health departments to dedicate specific allocation to that group. And so I know there are people in the higher risk category that are getting vaccinated first, but you're right. I've seen when I visited those vaccine sites, there are a lot of volunteers who wait until the end of the day and then they have the opportunity to get vaccinated. So I've seen that people sign up for that too. But let's go to the next question. This comes from Miss Jean. Let's see, Miss Jean Simonian from Fullerton. Is there FDA approval for the COVID-19 vaccine? If not, is there, let's see, if not, does the vaccine have the required validation for FDA approval?
I think the FDA has done an excellent job, and the only two vaccines that received emergency use authorization is these two vaccines, Pfizer and Moderna. As you know, J&J, Johnson & Johnson, has the single-shot vaccine, and that is pending approval. Probably within the next week or two, they will get approval. But the FDA has done their job really well, processed really well. They collected all the data. They didn't seem to be hurried or pushed through. They made all the documents public before getting the approval, and we were all able to review that. And there was sufficient discourse, and I'm perfectly satisfied that they followed the process and did their due diligence prior to granting approval for these two. And their criteria for granting approval was they needed to study 30 to 40,000 participants prior to granting approval. These were well done, rigorous trials throughout. And in terms of safety, now we have more than 100 million people, more than 100 million who've gotten the vaccine throughout the world. And it seems to validate the FDA approval that it is a safe vaccine. And we have not seen any of the side effects that will be so concerning that it would dampen the enthusiasm for this vaccine. We have not seen that at all. So they've done a fabulous job in looking at the data and approving it.
Right. The next question is very personal too. You know, because of so much lockdown and the concerns of, you know, COVID being spread from one person to another, and despite how much precautions we take, you know, we're not seeing each other in person. So the question comes from Miss Rhonda Gansel and Miss Jeannie Correll from Fullerton. The question is, how soon after the second vaccination can grandparents visit their grandchildren, and what precautions need to be taken?
So it's about 2 weeks after the second vaccine, you're considered immunized. So the question is it safe to visit or not? We talked about potentially the small risk of transmission from your nasal mucosa to the kids. And the kids, as we know, the grandchildren, they don't get at least severe COVID or significant COVID. But can they transmit to somebody else within the household? It's a potential possibility. Again, once again, risk mitigation, we cannot eliminate the risk. I would be in favor. I know Fauci got into trouble because he didn't answer this question recently, but I would be in favor that you follow the guidelines that we normally do. Wear a mask and hand wash, and you should be able to visit your grandchildren. The risk is very minimal after 2 weeks after the second vaccine. I don't know, Dr. Sharif wants to add something.
Yeah, I think I agree. Probably, especially in elderly, after you are vaccinated, probably wearing the face mask. And meeting the grandchildren outdoor will be the best scenario, or if you're meeting them for lunch or dinner, as long as you're outdoor, I think there's more safety and protection as compared to indoor. So, until we have more data available, end of this year or early next year, I think we need to take all precautions. I don't think that the vaccine itself gives us 100% immunity. So, especially in the elderly, we have to be more cautious.
Sure. Related question comes from Ms. Donna Zacher from Fullerton. Can the second shot be obtained from a site different from the first one if the same vaccine company is used? I think Dr. Matthews, you may have addressed this in your presentation. I'm not sure if it was you or Dr.
I will answer that. At St. Jude too, because of vaccine allocation and tracking, we recommend the second vaccine be obtained at the same site where you got it from. But if there is difficulty in travel or the person is unable to go there, we have accommodated giving the second vaccine, second dose at our site. However, we insist that it be the same manufacturer, because the CDC says so. CDC wants the same manufacturer, except in rare circumstances where it's not available or the person does not know, we should use the same thing just according to CDC. But we would accommodate giving the second vaccine dose at another site if they have a valid reason. Otherwise, just for allocation and tracking, we ask them to go back to the original site.
Okay.
I will just add to Dr. Matthews' comment. So most places are suggesting to get both shots at the same location, but I'll give you my example. So I was rounding in the Valley, so I got my first shot over there. So next, I was rounding at San Francis Hospital, and they have the same vaccine available, so I got the second shot. So on my vaccination record on the card, they wrote it down, Northridge Hospital and San Francis. So they can track it down, but obviously I think it's much easier if you go to one location. But I have done it myself, 2 different locations, same vaccine.
Great. The next question comes from Miss Julia Moore from Fullerton, and this has to do with the insurance coverage. She says, we're retired. Recently, our insurance stopped covering telehealth visits. Is there anything you can do to resolve this? First of all, let me respond to this one. You know, I am personally committed to expanding healthcare access for all Californians. Telehealth is an essential resource that needs to be available to anyone who wants it. So I will work with my colleagues, any of my colleagues, regardless of party, to improve healthcare access and benefits. Ms. Moore, thanks for that question. And I have passed along your situation to my casework team in my district office in Placentia. And I will make sure that they contact you directly to try to get you more information and see if we can help you. Let's see if you both doctors can answer this question. Are vaccines safe? I mean, there are people that question whether or not they should get vaccine. And if I don't believe in vaccines, why should I get it? What do you say to that?
So many people say, I want to look at the data. There can be no more data than that you want, then more than 100 million people who've got the vaccine so far. It's as safe as can be, like I showed you, within the clinical trials. And the clinical trials have been duplicated in many countries, including, like Dr. Sharif mentioned, in Russia, in China, in UK, multiple countries throughout the world coming out with similar data about the safety. And at St. Jude, our experience is 20,000 vaccines we've given, we've been following them, and there has been no issue. But 100 million, what more can we need? And like I said, the Israeli study too, where they have been closely following, along with Pfizer, all their patients that they vaccinated, it shows that it's amazingly safe. So why not get the vaccine? Because the risk of COVID, if you come to St. Jude and like a few weeks ago and you see the lines of ventilators, maybe that would be convincing a person that the risk of vaccine, whatever risk is insignificant compared to the risk of severe COVID, getting intubated, and a family member being missing from the dinner table. I mean, that's the impact of not taking the vaccine.
Ms. I would just our audiences, the vaccine is safe. So there is no questions should be in anyone's mind that vaccine is not safe and you cannot get it. Anyone who is willing, they should get the vaccine. And the reason for getting the vaccine, as Dr. Matthews mentioned, about especially if you end up in the ICU, if you end up on the ventilator, the chance of your survival is less than 20%. So COVID causes significant multi-organ dysfunction. I mean, obviously, it starts with lungs and then it impacts other organs directly or indirectly. And US, almost 68 million people have received vaccination. We have not heard or anything reported from any of the states that it has caused any life-threatening issues. And all the data which was published from Europe, I think we have not been able, as Dr. Matthews mentioned in his talk, cause and effect relationship. And those were very limited number of cases. And especially in elderly population, they are always at risk for having heart problem, cancer, stroke, and other things just because of comorbid illnesses that exist and also their age. So the vaccine is safe. And the myths about vaccine is if someone cannot get pregnant and someone is tracking them, none of the myths are real in the social media. So if you hear anything, talk to your doctor or talk to us in these webinars and discuss about all the concerns that you have. We'll be happy to answer those questions.
Just one more thing I want to add to Dr. Sharif. He sees this more than me. The post-acute sequelae of COVID, which we call long COVID, so this is not flu. A significant proportion of COVID patients get symptoms much afterwards, including shortness of breath, fatigue, and muscle pain, feeling of fogginess. And this long COVID has significant effect on people much after the acute episode is over. At St. Jude, we have a special program for post-COVID symptoms, and we have a clinic and we monitor them. So this is not a disease to take lightly. And the vaccine, like Dr. Sharif said, cannot be dismissed because of the myths, because all the myths have been proved false. There is nothing that has stood the test of any scientific discussion or rationale. Someone who's not rational, you cannot make rational arguments to them. But if they look at it rationally, there's no better remedy than preventing COVID. There's really no good treatment for COVID right now. Once you get admitted, Dr. Sharif was right, 80 or 85% of patients on ventilators, they don't make it. We still don't have good treatment, but we have a very effective way of preventing it.
Thank you so much. I know there are a lot of questions that people put in the chat room, and also there were a lot of questions. And I believe going through all of these questions, we were able to cover most of it. But I just wanted to, because we're coming up to a close of our program, I want to thank Dr. Matthews and Dr. Sharif for taking time to join us today to share your expertise. I want to thank all those who joined us today with these great questions, and I hope they were answered. If you still have questions, feel free to contact my office. But I think what we're taking away from it here is that it is important to stay up to date on the most recent information available so each of us can stay safe and healthy. So to get that most up-to-date information on the coronavirus pandemic in California, you can visit covid19.ca.gov. And if you want to check your eligibility and to sign up to receive COVID-19 vaccine, you can visit myturn.ca.gov. Again, I want to thank everyone who tuned in tonight and asked those questions. It's truly, truly an honor of my lifetime to serve you and as your member of Congress in Washington, D.C. Before I go, I want to remind you, if you need help with casework, or if you'd like to subscribe to my e-newsletter to be informed about my upcoming events or where I am in the district, when I go back to the district to meet with community leaders, community members, visiting businesses, if you want to contact me, please visit my website at youngkim.house.gov or call my office at 714-984-2440 or my Washington, D.C. Capitol office at 202-225-4111. I want to thank you again, Dr. Matthews and Dr. Sheriff, for joining us this evening, and to everyone who took the time to tune in tonight. I hope everyone stays safe and healthy. Thank you.
Thank you, Young. Dr. Sheriff, thank you very much.
Thank you, Young. Thank you, Dr. Matthew. Good night.